Hello, we are just waiting for my time slot, and I'm fiddling around with my phone here, and probably going to make bags of it. I know how to cope, I just don't know how to make Facebook Lives. I'm never quite trusting of technology. So anybody who's watching, please be patient and bear with me. Forgive me my technical unknowing, but rest assured, when you're on a treatment couch, I know what I'm doing. And I think no matter how organised you are, you always think you're not organised. So for anybody perhaps that's on, if you want to say hello, or if you have a particular question you would like to ask me at this stage, and then I might, if it's not something I was going to address or speak about, perhaps something that might be relevant to you. Hello, how are you? I'm just waiting for my time slot in case you're wondering why I'm not quite talking yet. So I'm not due to start for another 7 minutes, but if anybody has a particular question they'd like to ask me, and I can take a look at it, and if it's not something I was going to cover in this little intro and demo, I will endeavour to do so. Perhaps there's something that's significant for you that you'd like to ask. And don't worry, maybe you don't. Maybe not until I start. Will you have lots of questions? Or a question? Or a aha moment where you go, oh, that's what that is. So I suppose a question for me to ask anybody out there is if you have ever experienced cupping, if you have ever heard of it. The likes of Gwyneth Paltrow made it quite famous on the red carpet with cupping marks up her back, wearing a backless dress. An American swimmer at the Olympics, last Olympics, which would have been 5 years ago, I think, or a number of the swim team anyway, also brought a little bit more to the fore by their appearance at their swim meeting with cup marks. And recently, The Rock Johnson, if you're familiar with him, he posted some social media pictures where he had cupping marks. And it looked like something that should hurt, but it doesn't. So, due to be starting in 4 minutes, I believe. So I'll just take a sip of water. What a cracking day it is today. It's my first day not wearing socks. I'm pretty excited. Summer is here. Well, it's on its way anyway for today. Let's be present and be grateful for what we've got today rather than focusing on next week. So yeah, cupping on your back may not be the thing to have if you're planning on wearing a swimsuit, but it depends on the person. Hello Miriam, how are you? It's kind of funny to be talking to people in the virtual world while you're making a video. It's still not something I'm wholly used to. So we'll be starting in a few minutes. So I don't know if you've ever had any question relating to acupuncture. Sorry, not acupuncture, cupping. Jesus. There you go. Testing you to know if you're on the right talk. Oh, my Bridget, yeah. I'm all about the Bridget. See my little Bridget's cross here? She's a pagan goddess of healers, poets, blacksmiths, midwives, fertility, creativity, all sorts and beyond. I've got a bit actually, and you can find lots of it online, but I've got a bit on my website actually, on my little Bridget's doll. I'm going to be using her as a demo. She's beautiful, isn't she? I didn't make her now. I'm going to be using her as my little demo for sinuses. Yeah, my children wouldn't go onto a live video. Couldn't convince them to be my demos. So I'll be using both myself and Bridget. But we're good mates, me and Bridget. We work well together. So we're just going to wait one more minute and then we shall start. It's amazing actually. I'm really blown away with the ability of Freddie to bring all of these things and all of these people together in this virtual world. Hats off to him. My disclaimer, by the way, for those of you watching, is I'm a holistic therapist, not a video maker, okay? So, and this will not be edited. It's raw and real. But yes, if you're on treatment table, it's be a different thing, obviously. Okay, so we're just at 11:40 now. Give it 2 seconds just for Freddie to grab it and stream it. off to all the people who are able to figure out how to do all of these things. But yeah, in answer to your question, she's that's a tablecloth, or not tablecloth, sorry, it's like a tea towel cross wall hanging. It's on 100% cotton, and I got it framed at my local framers. Yeah, it's a nice way of having her actually. I really like her. I've one outside the door as well, but that's on a metal thing for signage. I'm all about the Bridget. Okay, so I think we're going to begin. As it's just gone 11:41. I'm just making sure that it's on. Okay, so for any of you that don't know, I am Fiona McDonough. I am the owner therapist of Love Clinic based in Gort Town Centre in Galway. I am an acupuncturist, craniosacral therapist, sound therapist. I also teach small mindful classes of yoga, and I love to do combination workshops of yoga and sound. So I'm rather looking forward to change this year in regards to rules and regulations around that at the moment, and I look forward to getting back to it. So I love group work, but I do work one-to-one with clients, and cupping is the most amazing thing. I do think if you've never experienced it, it looks like it should hurt. And I was saying it there when I was just waiting to go on. There's 3 places where people have often seen it. One is Gwyneth Paltrow appeared on a red carpet event with a backless dress and cup marks. I actually don't know if I've ever seen the picture, whether it looked particularly bruised or not. The other is at the last Summer Olympics, some of the American swim team appeared at swim races with also cup marks. And recently, one of the most recent that I know of is The Rock Johnson. He shared a social media post where he had marks on his back. So cupping, what is it? They literally look like cups. So these are glass cups that I have. Those are glass ones. And then I have a whole host of different silicone ones. This is called a contour cup. These are 2 different sizes of silicone cups. And then the latest ones I got, these are called negative ion cups. And these ones I got from America. These are some much smaller ones. You can use them both on the body, but these are particularly, you'll find them where they're advertised for facial cupping. So, cups, why use them? Why do they work? And how to use them. So these 2 guys are glass, and they are used with fire cupping. So fire cupping, I light the flame, put it in underneath, it creates suction, you stick it on. They're kind of heavy, and this size particular only used for the back. But why to use them? So what they do is, if you are familiar with your own anatomy slightly, I'm just going to tilt this slightly so you can see what I'm doing. So underneath your skin, you have a layer of fascia. So it's like a skin underneath your skin. So what cups do, I'm going to use demo with this moment and my own arm, is I'm going to lift the skin slightly. It uses suction. You see the skin is lifted up slightly inside. So what I do is I apply a little drop of oil. This is just a regular carrier oil. I apply it to I'm going to use my arm. It's quite difficult for me to demo on my own back. And I can just slide it and glide it. So what that does is it helps to release the fascia from the skin, the fascia from the stickiness of fascia itself, and muscle. So it's like, they say that 5 minutes of cupping is equal to 30 minutes of deep tissue massage. But the difference is that I use suction as opposed to pressure. Now, that's good for when you're passing cups over and back the spine, because you can get into the teeny tiny muscles that are along the spine and help release them out a little bit. Now you will feel a tightness when this is, because it's sucking up, right? And sometimes then, as you can see, when I take that off, you have a red mark. Now that's going to fade very quickly because it hasn't been on there very long. But that redness, it looks inflamed. It looks like it should be painful and sore, and it's not to touch. And you may have seen pictures where people would have had bruises or much darker red marks. That's an indication of sometimes of what's going on inside the body. It's also an indication of the suction level that could be used. The idea would not be to bruise somebody, believe it or not, but it can be what happens as a byproduct of having cupping done. So it looks, as I said, like it should hurt. Oftentimes people look at somebody and go, oh my God, what did they do to you? But it doesn't hurt at all. And trust me, I've had cupping done pretty much everywhere in my body. And I've cupped a lot of people in lots of different regions, and they're quite surprised about the sensation of cupping. And it's a difficult one. Sometimes it's a difficult thing to verbalize a feeling and how it feels in your body. So oftentimes the best explanation is actually to experience it. And of course, everybody's experience could be slightly different. But personally speaking, I would find, say somebody comes into me for sore shoulders and neck issue, I find a bit of gliding and sliding and moving cups around helps massage out the muscles a little bit. It really helps to settle the patient on the bed. And then I only leave them on for about 10 minutes. That can induce a little bit of bruising, but it may not. It depends on the person, depends on what's going on with them. If it does induce a bit of bruising, that's an indication of where in the body that's going on. I would use them when I'm gliding and sliding them around. So I'm loosening up the fascia, I'm relaxing out the muscle. As I say, it's like a deep tissue massage. That would indicate to me, by what I'm seeing, about where I would treat. And sometimes somebody could come in and they're very clear that they have a pain up here in their shoulder, but when I'm gliding the cups around on their upper back, I wouldn't be just treating here, I would be treating from the trapezius, which is down here, up to sort of, if I can do, up to the back of the neck and out to the shoulders. And I might find that down here is somewhere that feels tender to them. Down here is somewhere that comes up kind of red as I'm moving them around. So I would most definitely always treat it. I've got this, as I say, these small cups. This morning I was treating somebody and I was using this cup down along her arm and her wrist. She fell and she hurt her tendons. And if you're out there, you know who you are. And this was to help to release the muscle. And after a few sessions of having both acupuncture and cupping and a bit of moxa, her tendons in her arm are feeling an awful lot better. And she fell, I think, October of last year. So it can be hugely beneficial. You can use them on calf muscles, the IT band, as I say, backs, faces. Like this is a great one for using for sinuses as well. You slide and glide across the face, kind of gently. You don't pull the skin too much. And then you've got this tiny teeny one, and it's a squeeze and release technique. Great for sinuses, lines. I could do it a lot more myself. But a wonderful thing to help relieve and move the fascia and the skin and the muscle and relax it. Oh, that actually feels really nice on my skin. Just a couple of minutes of doing it. Definitely should do it. Definitely should do it a bit more. With the cupping as a session therapy, some people can come in and have cupping done just standalone, and I usually would combine it a little bit with craniosacral therapy. Very relaxing and wonderful, really beneficial to people, because some people obviously have this thing about needles that they can't, they don't want to go for it, or they don't enjoy them, or have had an experience before. And a lot of the time though, I would combine cupping with acupuncture, sometimes moxa depending, and a little bit of massage at the end. And I find it does amazing things for loosening the muscles and relaxing down, and making people feel at ease. It's amazing to see people whose necks can, just loosen up and create ease for them. These flat cups, as I described them, are the negative ion cups, and these are only used for stationary. So I would move cups up around, usually this size one, up around the back of somebody, and then these are the ones I would leave stationary for somewhere between 5 and 10 minutes across the shoulders. They're great. They pop on and pop off. You turn them upside down and you clip them onto somebody's skin. So these are all silicone ones that I'm talking about here. So you just squeeze them and they suck up the skin. So that's how it all works. So that's a kind of a squeeze and release technique. And there's many, and I could just leave it stationary. So if I was working, say, on somebody's arms who've got issue with tendons or whatever else, I would use probably this one to start and working it up and down, and I would find the place that just feels a little gristly, and you can feel it with this, and oftentimes it will actually just slide off at the point where there's just a little story going on underneath. And I would out to ease out the muscles all around, and then that would be the place where I would leave it stationary, just for a few minutes. And what happens? Why does it help? Is that area that looks red, looks like it should be inflamed, looks like it should be painful, but it isn't. It isn't painful at all. What your lymph system does is it kicks in to heal what it deems to be inflamed, and it sends nutrient-rich blood to the area. So the lymph system is feeding the area all the nutrients to help heal what it deems to be an inflammation, and it, by a byproduct, it feeds the muscles all around it. So in terms of overall wellness and health and immune boosting, which is a big thing at the moment, say I'm treating somebody's upper back, I'm also going to be treating their lungs, because all of those cups moving around is going to be really, really helpful to boost the lung and one's immune system. If somebody had a cough or a cold or congestion, actually treating your lower back and treating the lung area, treating all the muscles, is very helpful for that. Actually, the first time I would have had cupping myself, I did slight, I wouldn't have called it a head cold, but a slight congestion. And I remember I got up off the bed after 10 minutes and couldn't believe how free and easy it was for me to breathe. But nobody had touched my nose. They'd only been cupping my upper back. So it's an amazing, amazing therapy. If you've never experienced it, I highly recommend it. The more you have cupping, the less you will mark as well. But of course, if you're planning on going out in a backless dress like Gwyneth Paltrow or a bathing suit, it may not be the look you want to go for. I did treat a lady one time who I know she was heading for her husband's 40th birthday party, and she was coming for cupping, and she did like it when it marked her, but on this event I said maybe we won't, because you're wearing a backless dress, because you may enjoy it, but after the 20th person has asked you what are the marks on your back, you might be kind of irritated. I have cupped small kids. You can certainly use it very safely with them. Very good, as I say, for congestion, lungs, even constipation, using it on the abdomen very gently. With kids, cupping would be only 10 minutes, and you really don't leave them stationary at all. I do have one family that come to see me on a regular basis, and they love their cupping, absolutely love their cupping, and are delighted when they see that Fiona has new cups to play with, as it were. And kind of like this whole idea of having a unicorn look. Not one to be recommended. But yeah, so that's kind of, I suppose, the understanding behind cupping and how it can work, and why it would work. It is deemed to be part of acupuncture. It would be certainly part of a session that I would do with people. I have often had somebody come in for, I think a lady came in yesterday, and it was just a kind of a gentle treatment she was looking for, but she had a little bit of niggliness going on in her calves, and so I cupped out her calves a little bit at the end, and yeah, it makes all the difference. I treated an Irish dancer one time who had a massive knot in her calf, and we worked it out using cupping. And I'm not using pressure, as I say, you're using suction, so you're pulling up and away, and you're trying to loosen the muscle, the fibres of the muscle, in just a different way. And I can I suppose determine the suction by how much I suck it. You know, it doesn't have to be very, very strong suction in order to help glide and move the muscle and the fascia. So yeah, that's kind of it for cupping. I suppose it brings redness to the area. There was one lady I know, and her teenage son had cupping, and while he felt the benefits of it, his mum didn't seem to like the marks that it left. So that's one of the things of cupping. It can leave marks, doesn't always. It's not necessarily a good thing it does, it's not necessarily a bad thing if it does. It depends on what's going on with the person. It's very subjective. There's no hard and fast rule. Yeah, and that's kind of sort of it really for cupping. You wouldn't treat somebody who has too many allergic skin reactions, or if you have, you can treat over scarring once it's healed, but you've just got to do it very gently. Not over broken skin, or if somebody has a high fever, or if they've got massively inflamed skin, no. But you can treat around it, certainly. Or if somebody is particularly bony, or very, very thin layers of muscle, excessive body hair, I suppose, and somebody who's got a chronic condition, circulatory issues that would be not benefited by movement. So if somebody's cold and they need to build a little heat in their body, this would actually be really, really good. You wouldn't strong cup on the face, and yeah, just mindful of the areas in which you're doing it. Like I've done, as I say, upper thighs, down the side, glute muscles. This big guy I've put on the back of somebody's glute to help sciatica. It's really, really good. And again, you're not digging in, you're pulling out. So it's helping to shift and move things in a really subtle way. And I suppose part of the thing about cupping is the marks and the potential bruising. While it wouldn't be my goal and my aim, it's to help to make somebody feel better. While your body and your lymph system is healing that area, it is a treatment. It's treating itself. Your body is working on itself. So it does look like, it looks like a really negative thing, but it's actually a positive. So for while the bruise is healing, it's your body is working on itself and sending nutrient-rich blood to the area. So it's a very interesting part of what I do, and I find it amazing. I love introducing it to people, and people reap great benefits out of it. If you've never had cupping, I'm only out and gold. Do come along. As I say, you can have cupping as a standalone therapy, you can have cupping and acupuncture, or you can have cupping and craniosacral, which is something I do for a client who really enjoys the combination. So I do hope you've enjoyed it. I hope that it has answered any questions you may have around it. And if you have any other ones, please feel free to post them to me later. Okay, thanks for joining me. I appreciate your time, and I hope you get to enjoy the sun. Thank you.